All right. Good morning. So, I am Dr. Joshua Grenier, and today I'm going to talk about a topic that is near and dear to my heart, something I really wish people were talking about more, and that is oral probiotics. And August 21st, it is National Hazy IPA Day today, sponsored by Sierra Nevada. So, to reinforce some of these concepts, we're going to make a lot of hazy IPA related explanations. So we're going to sprinkle those in there so you'll see those. But let's dive right into the science and discuss oral probiotics and why they work, beneficial bacteria, and how they can transform your dental health. So we'll dive deep, interesting, and again, you're going to start seeing how these can really help treat periodontitis and dental caries in a very concrete way on this National Hazy IPA Day. So beneficial microbe, the whole idea, and science has proven this, and intuitively makes a lot of sense. If you have microbes that live in your mouth, normally don't seem to cause trouble, and you have enough of them, you can have them confer some beneficial qualities to your mouth. So it will counteract the bad bacteria. They can actually complete, and this is the idea, is like a perfectly crafted hazy IPA is balanced with hops and malt. Probiotics restore harmony to your oral ecosystem. That's the whole idea. And these beneficial bacteria come to play. They have the toolkit to compete with bacteria that we don't want in our mouths if we give them a little push. So the whole idea is it really is a crisis. Virtually everyone in the world has or will have dental caries. A lot of people, around a third, have periodontal disease, and both of them are equal in terms of tooth loss and edentulosum, dentures. So it is a problem. It's not going away. In fact, it's getting worse. They're broadly classified into two different diseases. Periodontitis is an inflammatory condition where biofilms are able to grow essentially uncontrollably on the outside of teeth, and they start growing towards the bone. And you will see bone loss. You'll see a variety of problems. Like in this picture, you can start to see early signs of bleeding around the gum tissue. And that's a sign that there's some sort of bacteria there. Dental caries as well. And that's the idea, is you have acidogenic biofilms. And what you'll see here is the results of that. You'll see white spot lesions. You'll see decay, and that's what those brown areas there. And within those brown areas, those are soft. So if you take an Explorer, you'll be able to see them, and they are just chock full of bacteria, which is now beginning to live inside the tooth, and it's beginning to migrate towards the pulp tissue. And it doesn't just live in the cavities. You can see there's white areas all over these teeth. So it is living in a broad spectrum all over the mouth. This biofilm is not just in one area. So what do we do about it? And obviously the first step is to stop eating acid and sugar, which when you see is on the outside of the mouth, that's likely what it's caused by, some sort of drinking soda or something like that. Even non-sugar drinks can cause this type of damage. So that is the first step there. Now, the traditional approach for something like that would be to take a burr or a handpiece and just grind it all away. But you're going to start running out of tooth structure quite quickly, and it's very different to keep up on if you're not changing that environment. And for periodontology, it's much the same. You're going to take a metal instrument. You're going to try to scrape away all the bacteria. And then you do that every 6 months because that's what insurance pays for. And you sort of hope for the best. But again, you're not really changing that environment, and bacteria grows quite quickly, so it tends to come back. And if the pockets get quite deep, meaning you start to lose significant amounts of bone, it becomes remarkably ineffective past 7 millimeters, and even between 3 to 5 millimeters of pocket depth. So the idea is, well, perhaps if we use probiotics, like crafting a hazy IPA, it's about adding the right ingredients. So you'll have the beneficial bacteria grow and create balance versus just getting rid of everything. So it's a little bit more of a nuanced approach. So how do they work? And it's very simple. They already have the ability to grow well in your mouth. And they're very simple to find. More or less, you look at people with healthy mouths and you look at what bacteria they have. You look at people with unhealthy mouths and figure out what bacteria they have. And it is just a matter of effort to figure out and identify these potentially beneficial bacteria. And there's some that just work fundamentally different than other bacteria. Now, bacteria, again, they come to play. They have various chemicals, toxins that are bad for other bacteria, specifically bacteriocins, which are a wide family of proteins that allow them to fight pop cell walls and stuff like that, destroy genetic information of potentially pathogenic bacteria. They have even hydrogen peroxide. They can change the environment around them to suit themselves, which is usually good for you if you pick the right bacteria. And the idea is they disrupt the formation of plaque. Virulent biofilms have what they're starting to see is a hallmark, and that is corium sensing. It's the ability of these pathogenic bacteria to communicate within each other once they reach a certain quorum, an amount, a number. And beneficial bacteria can suppress that signaling and actually prevents them from becoming more structured and more virulent. So that's a good thing. So it's just one of the many ways. And they compete for resources like a hop would compete for your palate in a hazy IPA. These probiotics compete for adhesion sites and nutrients with pathologic bacteria. So they have superpowers. They can go head to head with other types of bacteria in a way that you just can't do with a toothbrush. And again, they have metabolites. They're highly adapted to do what they do. Just like a hazy IPA's complex hop profile makes a distinctive flavor, probiotics produce unique compounds that target specific oral pathogens. So they really know how to take on the competition one at a time. And they also not just interrupt competitive bacteria one-on-one, but they can also interfere with other hallmarks like this biofilm, this polysaccharide biofilm. They can actually break that up. And that's a good thing, because that is really how that foreign biofilm, that virulent biofilm, is able to resist other types of things like mouthwash and brushing and pH changes. So by breaking that up, it becomes much more vulnerable. It disrupts other biofilms, and that's a good thing for me. And like a balanced hazy IPA, probiotics create a oral environment. So now, beyond these direct antimicrobial effects, they can actually tune the host response. Perhaps there's really two sides of the coin, especially in periodontal disease. You have the growth of the bacteria, and then you also have how the host responds to it. And part of they're definitely related, because a lot of virulent bacteria, red complex bacteria, can actually go head to head with immune cells, and they can begin to cleave them, gingipains and stuff like that. So by getting rid of them, you're going to lower inflammation as well. And probiotics have repeatedly been shown to be associated with a decrease in inflammatory cytokines, of which there are some specific ones, and actually show, again, they enhance anti-inflammation mediators. So they're talking about IL-10, TGF-beta, and they suppress TNF-alpha. And you'll see these names over and over and over. And essentially what they're saying is your body is trying to respond to something. It sees a problem. It's trying to ramp up the localized immune system. And by measuring that, you get a pretty good sense of what may be going on sort of behind the curtain. So just like a smooth, hazy IPA calms your day, probiotics calm your gum inflammation. So that's your take-home message. So probiotics for periodontitis, clinical studies show that it can lead to some improvements in periodontal clinical parameters. But Brian, I'm just going to go on my soapbox for a second. Clinical parameters in periodontitis are really, they're incredibly antiquated. The number one thing they do is sort of stick a metal spike around the gums, and how far that spike goes in is supposed to give you a complete picture of what's actually going on behind the scenes, but it really doesn't. It's sort of like tracking the weight of a cancer patient, and if that's the only thing you're tracking, well, once they've lost a significant amount of weight, I guess that's bad. That's basically what periodontists do. And it really doesn't paint a whole picture. It doesn't allow you to actually understand what's going on with the disease. And it's certainly not a way to guide your treatment. But that's what they do. And that's one of the reasons why they haven't been able to move past certain issues. But when you start to get past that, and it's also one of the reasons why clinical studies that measure probing depth probably aren't going to give you any kind of good results, because it's such a highly variable measure. It's just not good data, and it doesn't really tell you that much about what's actually going on, what the actual factors are. So, and again, there are some benefits. There's been multiple meta-analyses. There have been umbrella studies of those meta-analysis, and they do show a slight benefit, but it's not incredibly, it's very heterogeneous. The data is just not good. It does show a statistically significant improvement in bleeding reduction, which is just the amount of blood that sort of very easily comes from your gum tissue, which is probably an incredibly high, it maybe corresponds somehow to the amount of inflammation you have in your gum tissue, but it is really not. It's some sort of sign of disease, but the correlation between that and the amount of disease is very weak. So it's like if you smoke, you may have some improvements in periodontal disease. So it's just not, the core data you're collecting isn't good. So I think you have to be a little smarter in the types of way you interpret these types of studies. So, and just like a perfect hazy IPA needs consistent quality ingredients, probiotic work best with consistent use. And that's another thing that they've shown, is that the longer you're on it, the better it works. So we're talking around 6 months. It doesn't work immediately. And as soon as you get off, the benefits can reverse. So it's sort of like you're giving this beneficial bacteria boost, and it needs to continually be boosted. There's a couple of specific use for dental caries. It has been shown to make a strong effect. It reduces caries risk, and to a lesser extent, actually the incidence. So it reduces definitely the risk factor. So it has been associated with lower strep mutans counts, which is the principal initiator of caries. And strep mutans is quite dangerous, because you may have a certain amount of sugar in your diet. You'll have a certain amount of strep mutans, and strep mutans creates lactic acid, among other bacteria. And lactic acid acidifies the environment, which can create a runaway effect where only those types of bacteria are able to proliferate in your mouth. So if you have other types of bacteria that can compete with that at an early level, you can stop that cycle. And a lot of them fundamentally work in a different way. And again, these are bacteria that are found in healthy people's mouths, and there's a reason for that. And one of them is that they break down, and they have metabolic processes that raise the pH, at least some of them. There's a wide variety. And the results are good. You have fewer early lesions, fewer cavities in the realm of 30%. You have a lower risk of cavities progressing. And 30%, that's very significant. That is actually comparable to fluoride, believe it or not. And I'm not saying that they should replace fluoride, but It is that big of a boom. This is very significant. 30% is really incredible. And there's a few strains. There's a lot of them that have been identified. I think more of them will be identified. But lactobacillus, reuteri, and they are just consistently M18. There's quite a few. And again, they're beginning to identify not only what the bacteria are, but their mechanism of action, which just lends some credit to these, to how well they actually work. Now, how do you actually get them in your diet? Well, it's quite simple. Most of the time, you just use a tablet, but you do have to get to the site. So, like choosing the perfect glass for your hazy IPA, the delivery method affects how well the probiotics work in your mouth. So, there you go. Now, a lot of them are just lozenges and gums. You don't chew them up, you just let them soak into your mouth. This works very well. There are some mouth rinses as well. These work quite well. And even dairy products, milk or yogurt, which could certainly be used. Another natural pairing is, antibiotics, where if someone's on antibiotics, maybe they want a probiotic too. But the idea is they don't necessarily, and antibiotics. And then we're also talking about mouth rinses. And there's a growing, and this lends credence to the idea, well, if you're using something like Listerine alcohol-based mouth rinse, you're certainly going to kill a lot of bacteria. But the ones that are going to survive are the ones that are already tucked very far beneath your gum tissue, already in established, very mature biofilms. So it's possible you're killing off the good bacteria and you're not having that big of effect on those calculus deposits far beneath your gums or at your gingival level. So it doesn't necessarily make a whole lot of sense. And that's why we're maybe not seeing the kind of benefits by just broad spectrum killing of bacteria. So the idea is probiotics have the ability to specifically, like little soldiers that will go out and fight bacteria that you don't want in your mouth individually. And they seem to be very well tolerated. There's also the oral gut bacteria. We're starting to understand how your gut certainly plays a role in digesting food. And there's a lot of pathology that can generate in your gut. And this isn't, and we're talking, if you watch another video of mine, we're talking about colorectal cancer, which is directly related to Fusobacterium nucleatum, which is found in the mouth. So anything that can compete with that, and oral probiotics can, is probably going to be a good thing. So there's a lot of analysis, and it probably is a two-way street where its systemic health plays a role both negatively and positively in both environments, and also the kinds of things you put in your mouth. If you smoke, if you drink, if you have too much sugar, that may have a negative role in both instances. But essentially the mechanisms are the same. So like how a hazy APA's ingredients affect both aroma and taste, oral probiotics may exert systemic immunomodulator effects that benefit periodontal outcomes. So that's a bit of a stretch, but you get the idea. The best candidates are people with severe disease, and I think this is a much abbreviated list. Again, the problem is once you already have an extremely large amount of disease, it's sort of like planting a meadow in the forest. You're not going to necessarily see the effect very quickly, but if you clear the forest and then plant a meadow, it may be a lot more noticeable. So it has been affected. These are some of the studies that seem to benefit, some of the people that really seem to benefit patients with dry mouth or really high caries risk patients, which is a lot of people, a lot of medications, especially people that are living longer, have dry mouth. So this is an easy thing. It's cheap, it's low risk, and very effective. So I think it's something a lot of people should have in their toolbox. And the idea, it was also if you have antibiotic treatment, this is just a good idea to sort of build up the positive aspects of your oral microbiome. Now, some of the limitations of this is these effects do diminish over time, especially if they're not continuing administered. So you may have to keep doing this forever. And the core is you need to keep, not only keep doing it, but you have to look at you have to change the environment, which in the mouth means changing the diet, changing what you put into the diet. If you're drinking Mountain Dew every day, probiotics may help to a degree, but fundamentally, you're probably going to have bacteria that like sugar and like acid are going to just do quite well because you're continually pushing the environment that way. Results, again, highly variable. Part of that is because the way we assess dental health just isn't very good. We don't really look at disease. We look at very subjective even signs of that disease. So you're really not going to see a very strong effect using traditional periodontal measures. And again, it's not a standard measure. You still need to break up the biofilm somehow, especially if you have calculus. You still need to manually get rid of these biofilms because they do sort of grow throughout life. They really don't stop. So the future is, I think there's a lot of work we can do. There's a lot of bacteria, strain optimization. And, if you look at some of my other videos, it's not just about a specific bacterial strain. There are other types within one type of bacteria. You may have many, many specific strains of that one bacteria. So you need to be incredibly specific, and you have to really look at what these are. And that, you have to do it at a genomic level. And it's just an incredible amount of data. So I think this is worth looking into. Symbiotics. The other idea is what a probiotic is. It's the organism itself. And a prebiotic is the kinds of things that feed that organism. And the broad view is probiotics, organisms that seem to be commensal in your mouth, often don't strictly feed on sugar and sucrose and stuff like that. That's used very effectively, often by pathologic bacteria. They are adapted to grow with a wide variety of types of sources. And that could be a good thing. Things that we can't really use, they can use. And by figuring out exactly what those are, what types of food do you feed this group of organisms that this group of organisms doesn't like, is a science in itself. And there's a few candidates, but including a little food that goes along with this positive organism is important. It's a key piece of the puzzle. And in fact, you can improve your condition just by sort of feeding it the right things. There's specific types of sugars and stuff like that. And postbiotics. And this is a fascinating research. And what they're finding is if you just give them, the constituents of these oral probiotics, they don't even have to be alive. You can just give the various enzymes, the metabolites, the stuff that make up their environment, and we put that in a mouth. That's enough to start increasing their mouth and improving oral health. And surely, there's not just one or two metabolites. There's probably thousands and thousands of them. So certainly increase research and figuring out exactly what's in there. And perhaps there's many, many different types of, and I really predict by studying exactly what those metabolites are, we'll probably come up with a lot of novel therapies. How are these probiotics actually competing with pathologic bacteria? And if we can figure out exactly how, perhaps we can generate some sort of medicine that will help us in the long run. And again, meta-analyses, interestingly, the higher quality ones tend to show more of an effect, but a lot of dental research is difficult. It's clunky. It's highly variable. So it's sort of, and what they do with a meta-analysis, they're able to combine these together using some very advanced statistical methods. But in doing so, what they find, as is with a lot of dental research, is about half of it just isn't that good. So by looking, you also have to assess the quality of the research. So it's the idea with a meta-analysis, sort of like comparing different beer reviews. Meta-analysis combine multiple studies to give us a big picture of its effectiveness. And the idea is, it's sort of, you're seeing this approach, this ecological approach, like you have a garden or a forest you're trying to tend to. Maybe you don't want to just kill everything in there. The idea is you want to have a balance. You want to, alleviate the things that make pathogens grow, sort of like an algae bloom in a pond. If you put too much, too many nutrients in the pond, you may have uncontrolled growth. It's the same thing with sugar, and no amount of other bacteria is going to necessarily prevent that. So the safety profile, again, really, at least so far, they've been quite good. There seems to be a tremendous benefit in lowering pathogenic bacteria. They seem very risk-free. So again, the idea is, like enjoying a quality craft beer in moderation, probiotics offer benefits without downsides when used appropriately. Look, key takeaways. Now, oral probiotics, they are a promising adjunct. Some of the stats, some of the numbers show that they are very effective in not just caries, but periodontal disease. They seem very safe, and they're more of a complement. And I think we need to start thinking about oral disease as a dysbiosis, and sometimes very often an uncontrolled dysbiosis. So any effort to sort of bring that back into balance is not a bad thing. So anyway, cheers to oral health. Now, they have considerable promise. I think this is a good way forward. So tag a friend that needs to know about oral probiotics. And National Hazy IPA Day, drink responsibly. Your teeth and gums will thank you. And shout out to Sierra Nevada, who started this day in 2023. All right, thanks a lot.